Thank you. Now we'll hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. This morning I want to give the community an update on the results from the antibody testing and give you some background before we start talking about the numbers. In reviewing my notes, there was discussions between representatives of the city and county in May. Augusta University, which I was not aware of the fact until recently, the Medical College of Georgia, like many universities, was merged with Augusta University. And so actually the Medical College of Georgia is now under Augusta University. We had a collection site at the Civic Center which was run by the National Guard back in the spring. The results from that site were being submitted to Augusta University. Augusta University expressed an interest in doing antibody testing here in Dougherty County. And the reason, of course, was the high rate of infection that we had in March and April. There's a Dr. Cooley who was sort of the point man for Augusta University. He stated that the antibody testing in Dougherty County would have profound implications for the state, because the question was, we know how many people test positive, but from the very beginning we have made note of the fact that medical professionals are aware many people have the virus and exhibit little or no symptoms. The antibody testing would be a way to verify how many people actually had contracted the virus. And in these discussions in May, there was a reference of 1,000 people would be a representative sample, because that would be a little more than 1% of our population here in Dougherty County. There was another issue, though. How can we make sure that the people who are tested provide a representative sample of the community? And what do we mean by that? Obviously, what we are talking about is, could somebody let Dr. Black in? Obviously, what we're talking about is if Dougherty County is 68% African American, 2% Hispanic, we need those percentages in the testing sample. Also, we need to break it up by age. Dr. Cooley said that that would be a much more challenging endeavor, because at that point in time you have to have a control over who comes for antibody testing. Be that as it may, again, what Dr. Cooley was emphasizing is that Dougherty County, you need to know how many people have contracted this virus. But also, for the benefit of the state, we could extrapolate from your experience in Dougherty County and see the number of people who have tested positive and have a fairly accurate assessment of how many people have actually had the virus. In early June, we had further discussions. There was a proposal that the city and county would pay for the antibody testing so that there would be no charge to citizens. That would encourage people, hopefully, to be tested. The school board joined in on that, and of course the school board, we appreciate the fact the school board has been guided by the numbers throughout the fall and its return to school. The expense was divided three ways. There was a contract, and the contract called for Augusta University to be here in Albany between September 16th and September 29th, unless 1,800 samples were drawn before September 29th. And again, this is a test for antibodies. Well, Augusta University came on September 16th, and as you may recall, the participation was somewhat disappointing. Eventually, could we see the next? There were only 600. Could we go back to the previous slide, please? There were only 613 people who participated, and that was over the entire 2-week period. We stood on this podium and encouraged people to get out and be tested. Unfortunately, we didn't have the participation that we had anticipated. Here is what is extremely important. Of those 613 people, 132 tested positive for the antibodies. That is a rate of 21.5%. Okay? That means roughly 1 in 5 people participate in this community have been exposed or have contracted COVID-19, if these results are accurate. And we're going to go into some next slides, and we'll tell you why Dr. Cooley thinks these numbers might actually be low. This is the breakdown by age. As you see, we had only 2 people who were under 18 who came in, who were tested. The rates starting, as you see, the numbers between 51 and 60 were actually higher than from 61 to 70. We had the best participation in the 2 ranges between 41 and 50 and 51 and 60. What Dr. Cooley said, if we can look at this last column, over 70, you see that 26.3% of the people over 70 tested positive. Dr. Cooley said this was what he called shocking. Okay, can we go to the next slide, please? By zip code, here is a matter of great concern. We know the coroner has provided the numbers of the casualties. We know that 31701 and 31705, South and East Albany, were the areas where the death tolls were highest. Unfortunately, if you see here, our participation from South Albany and East Albany was much less than we desired. Only 83 people provided a zip code of 31701, and only 95 people from East Albany. There are some people provided post office zip codes 31702, 31703, and 31706 and 31708. But you can see our best participation was from 31721, which is the other side of Westover, and as we know, that is where the fewest fatalities were. Can we see the next slide, please? Again, 1 of 5 people who participated, more than 1 in 5 people who participated in the study had the antibodies. And the conclusion here is what is important. If this is representative of the total population of Dougherty County, it would suggest that almost 19,000 people have had COVID-19. This compares to the DPH's verified positive results of only 3,354. One thing I was noticing today, we can take that down, is the number of positive cases in several counties, in Colquitt County and Lowndes County, have actually exceeded our numbers here in Dougherty County. Dr. Black's here. The numbers that have been reported to the task force continue to be low here in Dougherty County, and I want to commend the public for continuing to exercise precautions. I do want to say in closing, Dr. Cooley pointed out he pointed out 2 factors why he believes this number is actually low. And the first is that some people in the medical community believe that some people who are infected with the virus, who had been infected early on in March and April, who did not exhibit symptoms, the level of antibodies in their system may be so low it was not detected in the antibody testing. Secondly, Dr. Cooley acknowledged that it is very likely that many people who had previously tested positive felt they had no reason to go down there and have the antibody testing because they knew that they had previously had the antibodies. And then thirdly, as I mentioned earlier, we know that the areas of our community which have been hit hardest are underrepresented in this report. I just wanted to give this information to the community because you paid for it and because it is important to know this seems to substantiate what we've been told from the very beginning is that many, probably most of the people who have been infected with the virus exhibit little or no symptoms. I want to thank you for your participation. Thank you.
Thank you, Mr. Mayor, for your report this morning. We will now hear from the chairman of the Dougherty County Commission, Mr. Christopher Cohilas. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. If we could go back to the Augusta University slide. Pull that up, please. Can I click through this now? Perfect. I want to echo much of what the mayor said and also add in a couple of substantive ways. This testing that we had from Augusta University was a huge opportunity for Albany and for Dougherty County. And I can't really stress enough how astonishing the results were. In my estimation, receiving the information from Dr. Kuhl from Augusta University. First of all, I want to also say thank you to the mayor, thank you to the city, thank you to the county, thank you to the school board for participating in obtaining this information. This is very high-level information that most other communities do not have access to. While we certainly would have appreciated and wanted better public participation, it does give us a tremendous outlook into some very, very high-level data. And one of the things I really cannot stress enough, that what I was able to glean from Dr. Kuhl was that the number of percent positive being 21.53% was a very, very, very high number for this community in comparison to many other communities where they have done this type of antibody testing. That was something that was very apparent in his discussions with us. He also mentioned the fact that there can be a bit of a bias in that some folks may have come in to get the testing because they thought that they may have had some symptoms and they wanted to confirm whether or not they had the virus, but they just weren't really sure. Those are some of the factors that he pointed out. But overall, the percentage of 21.53% was a very unique, very large number for a community of this size. It also, frankly, correlates to what we experienced in March, April, and May of this year, which was an astonishing amount of folks that were being overcome by the virus, that were becoming sick with the virus, that were, we had a large number of people, an influx into our hospitals. So we know that a lot of folks, other than those who were actually treated and tested, actually did contract the virus. And I said back then, and I'm going to continue to say now, information is our friend. Information allows us to make good decisions. It also gives us a good foundation for us to understand where we are at in terms of this marathon. One of the things that was really important to me to learn from Dr. Kuhl and from Augusta University and from the other health professionals that we've been speaking with is that there are different types of, quote, immunity that exist. While it hasn't been proven that if you have had the virus and you've overcome the virus, that you're absolutely immune, it is highly suggestive that you at least have short-term immunity. And that is the information we've learned from Dr. Kuhl. So in other words, if you had the virus in March, April, or May, you overcame the virus, it is generally accepted in the medical field that you at least have some degree of short-term immunity. Additionally, that means you have potentially the antibody within your body so that it would be subject to being revealed in a test such as this. Thus, you have an immunity that flowed from actually contracting the virus. Additionally, some of the information that Dr. Kuhl shared with us was this, that it appears to be generally accepted in the medical community that there are people that organically, just on their own, have an immunity to the virus such that they can't contract it and even be able to get the antibody because they just generally have that level of immunity. And it seems, based on the information that Dr. Kuhl was able to share with us, that may be more pronounced in certain age groups as opposed to other age groups. We know as a matter of fact that folks that have diabetes, hypertension, that are elderly, are medically fragile, that they are more susceptible to the virus and most certainly to its most devastating impacts. But one of the things that we're also seeing and that we're understanding is that there are people, particularly many young people, not all young people, and I'm not trying to provide medical advice, I'm just providing observations that we've heard, which is that there are, generally speaking, children tend to be less likely to contract the virus, which is a good thing. It's a great thing, and it's obviously something that we want to continue to make sure of, which is that our children are safe. That also correlates with the numbers that we've actually seen in the community with respect to fatalities. The fatalities that we have unfortunately suffered have been most pronounced in certain age ranges that are older, and that's obviously unfortunate, but we also have to take notice of the facts and of the information, which is that it is less pronounced amongst our children. So that's good information. So in understanding immunity, and one of the questions that I asked Dr. Kuhl was, okay, I understand that we cannot necessarily say that 21.53% of our entire community had the virus. It is, if you could extrapolate that, that would be great, but we didn't have a large enough sample size to be able to draw that conclusion. However, it is a good statistical point of information to understand that out of 613 people that were tested, 21.53% tested positive for the antibody, which is a very large number. And it is statistically significant to see that as we look at it across the different zip codes, relatively speaking, they were all fairly consistent. They were in the 19 to the 18 to 28% range, all very high numbers. Now, so one of the things I was asking Dr. Kuhl was, does this mean that only 20% or 28% of our population is now immune? And we've heard terms such as herd immunity. And herd immunity, as I understand it, is the moment or the period of time when a community reaches such a level of infection rate and overcoming infection that a percentage of your population, and generally speaking, as I understand it, it's between 50 to 60% of your population has a level of immunity to the virus, such that transmission becomes very hard to occur because, generally speaking, more than half of your population has immunity to it, so it becomes far harder for it to get passed from person to person to person to person, which is what we did not have. We had a zero level of immunity in March, April, and May, or at least in March. It grew as you overcome something, you become stronger. And obviously we hate the losses that we have suffered, but also as a community, we have become stronger. And one of the things that I learned from Dr. Kuhl was, okay, let's say we could extrapolate and say, and I know that we can't, but let's say that we did have 20% of our population that had the virus and overcome it. Does that mean that we're only at 20% with respect to reaching that 50 or 60% in terms of herd immunity. And what I learned was very interesting. And what he said was this, is many believe that actually you may be far closer to attaining herd immunity than you think, and using that 20% as a baseline, because those are people that tested positive for the antibody. But it is believed that many people who will never test positive for the antibody, who just organically have a certain level of immunity on their own just because God made them that way, those people are additional people that are immune, and that is an interesting factor for us to understand in terms of where we're at. And I have watched and I have seen as other communities around the state, the country, the world have braced and responded to this pandemic, whereas in March, April, and May, we were literally living through what seemed to be apocalyptic times, and we all were calling for caution and for being calm and making smart decisions, and we weathered that storm, and I continue to be cautiously optimistic. I'm not at all suggesting that we depart from living a more disciplined lifestyle, but I am thankful to see that we're getting this type of information, high-level information, that it continues to appear to be consistent with our progress. Actually speaking, knowing that if you were able to extrapolate and say that 21% of the population in Dougherty County had the virus and overcome the virus, that's actually a positive thing for us as a community, because that means, as I understand it, that we're closer to attaining herd immunity than we were before. And currently, we're doing that while managing a very, very low death rate, while we are making sure that people are receiving high quality of care. We are going on about our lives, though in a much more disciplined and different way. The hospital is not overrun with patients, and you don't have that feeling in the air that makes it feel as if it's an apocalyptic time. And so those are all good things that we're experiencing in this community, and I'm very thankful for that, and I'm thankful for that here in this Thanksgiving season. And I do think that here in Albany and Dougherty County, we have so much, though we have been through so much, we have so much to be thankful for. And I do want to stress to everybody, we have the Thanksgiving season. We have much to be thankful for. We have overcome tremendous odds, much better than any other community that I have seen that faced anything of this type. And we were able to do that because the city and the county worked together, the school system worked together, our medical professionals worked together, Phoebe, our first responders, our community, everyone rolled up their sleeves to do the right thing. And I'm just very thankful for that at this time, because 3, 4, 5 months ago I was standing here and it certainly felt a lot different. Again, I want to, if we could switch back to the other statistics, please, Mr. Good. To look at this graph, where we're here today on those numbers for November 16th of 2020. And if you were to cast your mind back to April 6th of 2020, this is we have a tremendous amount to be thankful for. I don't say that to encourage us to do anything other than to continue to be diligent and disciplined, but we have a lot to be thankful for. And I will again encourage everyone as we roll into Thanksgiving and the holidays, please continue to be smart. Many of our elderly citizens are going to want to interact with their grandchildren, with their children, with family members. It is, many may choose to travel. If you're going to travel, please do so safely. Please don't create a huge family reunion type of environment. Consider, and I'm a big believer in not telling people what they have to do, but encouraging what I think is right. And if you can make use of Zoom, if you can make use of FaceTime, if you can pick up the phone, if you can find ways to connect, have a virtual Thanksgiving dinner if need be, or do the things, just please continue to have in your mind where we were, be thankful for where we are, and let's celebrate that with a spirit of thanksgiving, a spirit of diligence, and of discipline. And again, I continue to say that this is a marathon and not a sprint. Thank you.
Thank you, Mr. Chairman, for your comments this morning. We will now hear an update from Phoebe Putney Memorial Hospital. We'll ask the medical director for emergency medicine, Dr. James Black. Dr. Black.
Good morning. As many of us have to choose between glasses and mask, if I have my mask on, my glasses fog up. So since I'm 6 feet away, if you don't mind, I'm going to take off my mask. If we can put up my graphs here, just to kind of echo what both the mayor and the chairman have been telling us, we are certainly so much better off than we were in March and April. And again, when a lot of the communities around us are experiencing surges, and certainly around the country we're having surges, we have certainly enjoyed kind of a moderate, actually a significant amount of success around keeping our hospitalized coronavirus patient population down. As of this morning, we have a total of 24 patients in the hospital diagnosed with COVID-19, and of those, 25% of those are actually transfers we took in from surrounding communities to try to help out as much as they helped us when we were in our time of need. I do want us to understand, though, that didn't come by luck. This is a bunch of hard work by the people of the community in helping us stem the tide and stem the spread. And I just want us to be cognizant, we know better than most how quickly that graph can see another peak. So we want us to continue to do those things that we've been doing in the past with the social distancing, with the making smart choices, wearing the masks, and certainly washing our hands or using hand sanitizer when appropriate. And we want to continue that trend. As Thanksgiving is upon us, though, we do realize that represents certain challenges and certain things that we would like to do. And Thanksgiving has been one of my favorite holidays, and getting forward to getting together, enjoying family, food, and football, as I like to say. And but we're going to have to do that smartly. And as Mr. Chairman said, we got to be very disciplined and continue those good practices that we did. So, you know, the CDC and as well as locally, we've been recommending limiting that travel, limit the size of your gatherings, and when possible, you know, in the afternoons the weather's quite pleasant, you may want to even think about gathering outside. But I also want to emphasize, as we've had this amount of success, realize that other parts of the country are not. So, and I had somebody tell me, well, it's just going to be family. They're coming in from Houston. Well, Houston's experiencing surge and their hospitals are overflowing. So just because of your family and your friends and they love you does not mean that they won't and can't make you sick. So just because they're related to you does not mean that they don't pose a risk. So traveling to see them or having them traveling to you can pose a significant risk. So let's try to make sure we do those things that are safe. On the other side of healthcare, I want to take a moment to just talk a little bit about some of the national trends we've seen in a lot of research and energy that's been put into, is the amount of healthcare that's being delayed because of concerns about coronavirus. And several articles are quoting numbers as high as 4 and 5 out of 10 adults. That's 40 to 50% of U.S. adults in the U.S. have admitted that they have delayed seeking medical care for both acute and chronic conditions. And what that amounts to, and I'll use a personal example, last week I took care of someone who had stroke symptoms for 3 days, and finally her granddaughter made her come to the hospital. And she said, I knew I was having a stroke, but I was afraid. And had she come in, when she first started having the symptoms, there are a lot of things that were available to us that we might have been able to help. But 3 days into it, there was not much we could do other than conservative ongoing management. And so my point is, I don't want us to be so concerned when we step off the curb about twisting our ankle that we forget to look both ways and get hit by a car. Coronavirus is in front of us, and it's something we want to be aware of, but let's also be aware of our ongoing health needs and making sure that we're taking care of our chronic conditions, our diabetes, high blood pressure, high cholesterol, and certainly when we're having those acute illnesses such as chest pain, shortness of breath, stroke-like symptoms, do not delay in seeking appropriate care. There's a great deal of energy and effort being put into maintaining the safety of our hospitals and our other healthcare facilities. We're very fortunate that we're able to use our North Campus primarily for our coronavirus patients, and that has allowed to keep our main campus open and available to provide those services that we've been accustomed to providing. So the main campus is fully functional, the operating rooms, all the diagnostic activities and everything is fully functional, and we've taken great pains. We're actually very OCD about keeping our patients safe and keeping our hospital clean. So I don't want us to delay those normal medical things that we should be paying attention to. There was one other article I read that interviewed women with breast cancer, and they started looking at women who should be having surveillance because of primary first-degree relatives that had it, but they were delaying getting mammograms. And there was another subset of women who had been diagnosed but were or had suspicion, and they were delaying getting things such as biopsies and even delaying chemotherapy. And they were trying to estimate the amount of ongoing damage that probably could have been avoided had there not been avoiding. And I'm certainly not minimizing the concern, but I just want us to be aware that we need to be in for the long haul. And as the chairman says, it's a marathon. We want to make sure that we're in shape to run that marathon. And if we neglect other aspects of our health, only solely concentrating on coronavirus 19, we can miss things. So take your medication, follow with your primary care physicians, seek appropriate medical care when you need to. Please do not delay. I want everybody to have a safe and happy holiday season, albeit at a distance, and let's make sure we continue to do those things that has gotten us this great amount of improvement. Thank you very much.
Thank you, Dr. Black, for being here today and providing an update from Phoebe Putnam Memorial Hospital. We will now hear an update from Public Health. We have Ms. Pamela Lovett with us today. She is the Director of the Dougherty County Health Department. Ms. Lovett?
Good morning. I'm going to discuss 3 areas this morning. First, I'm going to talk about the COVID-19 vaccine, and then I'll discuss the COVID-19 testing, and the availability. The third one will be the availability of flu shots. As far as the COVID-19 vaccine, we are hopeful that the vaccine will be available soon, but we are not able to say when that date will be. Plans are now being made for the distribution and administration of the vaccine. Every county health department in Georgia will be a site of distribution of vaccination. As of today, more than 1,200 other sites around the state have begun the process to be approved to administer the vaccine, and 20 of those sites are located in Dougherty County. The vaccine will be administered free of any out-of-pocket expense. So far, it appears that the vaccine is very effective and safe. Public Health will provide updates as soon as information is known. Secondly, we are continuing to test for COVID-19. Our hours of operation for next week, November 23rd through 28th, will be Monday, November 23rd, will be open from 8:30 to 11 a.m. Wednesday, November 25th, 1 o'clock p.m. to 3 o'clock p.m. And Saturday, November 28th, 9 o'clock a.m. to 11 o'clock a.m. You can make appointments 2 different ways. One way is to schedule appointments is 7 days a week, 24 hours a day. You can go to covid19.dph.ga.gov. That's covid19.dph.ga.gov, and you can make appointments there. Also, you can call our call center that's available Monday through Friday 8 a.m. to 8 a.m. to 5 p.m. And that number is 229-352-6567. Also, you can, if you don't make an appointment, you can just drive up because we are taking drive-ups also. And remember that flu shots are available, and we encourage you to get your flu shots at the health department Monday through Friday from 8 o'clock a.m. to 5 o'clock p.m. You can call for an appointment, or you can just walk in to get your flu shots. And remember to continue to mask up, social distance, and also wash your hands. Thank you so much.
Thank you, Ms. Lovett, for being here today, providing an update. If you must go out, please mask up. It's been reiterated many times today. We must continue to protect ourselves, our family and friends, our fellow citizens, and ultimately our entire community. It takes us all working together to help fight the spread. Let's all continue in our diligent efforts. We will see you at our next press briefing on December 4th here at 10 a.m. And again, we remind you, mask up Albany, mask up Dougherty County. Thank you so much and have a great day.